This bill also allows the board to contract for the payment of a reasonable fee to the council. If the board retains counsel, funds for legal counsel must be provided in the annual budget of the board. There are no amendments, there was no opposition, and we have received the local letter.
Been moved and seconded. Any objection to adopt this and send it to the floor? Seeing none, 5-5 moves on. Next.
Senate Bill 157, Baltimore City Board of School Commissioners, Student Members, and Task Force to Study Compensation. This bill alters the membership of the Baltimore City Board of School Commissioners by adding one additional student member. In addition, the bill expands the voting rights of its student members while also altering the selection process for student members such that the student members are nominated and elected rather than appointed. Finally, the bill establishes a task force to study board member compensation. The bill takes effect July 1st, 2022, with provisions relating to the task force terminating on June 30th, 2023. There are some amendments offered by the delegation. They begin on page 2 and the reprint on page 5. This amendment strikes the provisions establishing a second student member. It provides that the process to elect the student member is by procedures established by the board in collaboration with the Associated Student Congress of Baltimore City. It revises the matters on which the student member may vote, and it revises the membership of the task force to study compensation and expands the purpose to include studying whether to add a second student member to the board. So there is no opposition. Well, these recommendations were based on concerns from the Baltimore City Board of School Commissioners, and we have received the local letter for this.
Thank you. Quick question for council. You said twice, expand what the SMOB, the student member on the Board of Education, is going to vote on. Could you just say what those are and whether it's precedent setting?
They revised them.
Okay. Revised.
So what happens is, before they were excluded from voting on personnel, capital and operating budgets, school closings, reopening boundaries, collective bargaining, student disciplinary matters, and certain appeals. This does is it revises by saying they can vote on matters related to personnel, collective bargaining, and certain appeals. But they can't now vote, they can't vote on personnel matters, collective bargaining, no, capital operating budgets, school closings, reopening boundaries, and student disciplinary matters. So it just revises it slightly as the matters that they can handle.
There was a lot of discussion on this, a lot of back and forth, and we support the, expanding the role of the student. But again, this was one of those amendments where both sides don't like it a little bit. So we got a nice middle ground. So I move for the favorable. I move the favorable report.
You two will move the amendments.
Yes,
the-
the amendment was that
Okay.
the sponsor agreed to the amendment. Everyone.
Any objection to the amendments? Seeing none, they're adopted. The bill is amended. Anybody wish to be recorded in the negative? Seeing not, 157 will proceed to the floor. Next.
Senate Bill 348, Conservation Finance Act. So we are secondary on this bill, so we're looking at it after budget and tax. If this looks familiar, it's because it is very similar to a bill that was, this committee was primary on last year. The bill makes changes to a broad variety of existing programs related to environmental conservation and natural resources management, and expands opportunities for agencies to obtain private investment and financing for state environmental projects, including conservation efforts, restoration projects, and the installation and repair of green and blue infrastructure. The bill also alters existing and establishes new state policies for several related programs, and establishes a new work group, commission, task force, and reporting requirements. The primary agencies that are affected are the Maryland Department of Agriculture, the Maryland Department of the Environment, and the Department of Natural Resources. But there are changes to procurement and contracting opportunities, specifically pay for success contracting, that affect additional agencies. You should have on your desk both in the voting packet, the budget and tax amendments are included in that voting packet. They begin on page 9. But then the reprint is sort of separate, sitting on your desk somewhere. Conservation Finance Act. So the amendments to this one are actually fairly limited. The first amendment, which is on page 23 of that reprint, or starts on page 23 of the reprint, this just allows the Maryland Environmental Service, MES, to participate and pay for success contracting as authorized under the bill. In general, they are exempted from the procurement provisions in the state finance and procurement article. So in order for them to be able to take advantage of the new mechanisms that are set up under the bill, they have to have a specific or a different section added to the natural resources article. The other thing that the budget and tax amendments do, and this is on page 46 of the reprint, requires the Secretary of the Environment, when making appointments to the Task Force for State and Local Government Accounting for Natural Capital established under the bill, requires the Secretary to ensure to the extent practicable that the membership reflects the geographic, racial, gender, and cultural diversity of the state.
How many more are there?
That's it.
Okay, I'm sorry. I'm going to call on good Senator Van Arundel in a minute. Just context, we passed this bill last year. It was complicated. It went over the House and they thought it was too complicated and just sat on it. This year, it was sent to B&T primary and to us as secondary. So that's why it's here as it is. And it is complicated, and we had it last year, so feel free to ask questions, okay? Yes, Senator.
Two things. One is, did we have a representative in B&T, and could they give us any public hearing that testimony? Typically, if you're secondary, you have somebody up there.
Anybody remember sitting in on this in B&T?
All right.
Who?
So-
Lamoury, do we note if we sent anybody up on this? Yeah,
And second thing,
yeah.
I mean, we can discuss it, but I'd like a little time to look at it, like I did on Senator Ferguson or the President's bill last time. And I actually had some amendments and he took it, but this is 48 pages. I'd just like a little time to review it.
If people do it.
From the amendments, is the bill the same as it was when we voted out of committee last year?
I think pretty substantively, yes. I think there might have been a few small technical changes in the redrafting this year, but I can look into that.
Thank you.
Yeah, I'm sorry. Senator Ellis, followed by Senator Washington.
Yeah, thank you, sir. I'm looking at the fiscal summary, and I don't see any numbers in there, just words. So under the state effect, it says general fund expenditures increased significantly in fiscal 2023. It doesn't have a number, a dollar amount. And then on the small business effect, it says potentially meaningful. And so I don't know if I thought the fiscal summary, fiscal note was there to give us numbers instead of just words. I mean, is there a reason why they didn't quantify.
So if you look
we were-
later in the fiscal note, so typically that first page is just a short summary. More in-depth, it begins on page 15, actually, of the fiscal note. So it starts going through and approximating some of the fiscal impact to the state. And then it also, page 17 talks a little bit more about the small business effect. And, I mean, it's the small business effect in this case could significantly expand opportunities for private investment in state environmental projects. So potentially a benefit to small businesses, according to the fiscal note.
Okay. So,
Senator, on page 15, to DNR, there's a $1 million cost,
okay, page
and
15.
there may be others.
Okay.
Right, that's for a study under the, required by the bill.
And then what's that second page number you said, Ms. Morton?
So, I mean,
were other
it keeps
numbers
going
there?
on, so page 15 and 16 through the top of 17 have the more details about the state effects. Local effect is on page 17, and small business effect is on page 17.
And Senator, also, fourth line down on top of 16 says, most of the affected agencies that responded indicate that the bill's changes to existing programs can likely be implemented with existing budget numbers. The first full paragraph on 16, where it says most of the affected agencies,
16?
top of 16,
Okay, let me see.
first full paragraph, second and third lines.
Okay. 16. Okay, yeah, so, so one of the things, we need to look at audited financial statements as CPA is, we have these notes, like hundreds of pages, and if you want to kind of hide stuff, you stick it there, you know, you have to dig through thousands of pages. So I was on the impression that, you know, our fiscal note is the summary part will tell us the numbers, and they put it all together. And they're saying here we got to hunt for all these numbers to see the effect of the legislation that we're expected to pass, and it's not fair to us to do that. You know, I'm wondering why that was done. I know some of my bills, they stick a whole big number in the summary, you know, those cost $10 million, and that's it, you know, and so, you know, I'm just wondering how business is done around this place where.
That's a good question.
I'm still trying to find out.
Well, Senator, as it's been explained to us, some of this bill is to save money and do more effective investment in terms of environmental mitigation. And under local effect, they can't quantify it, but say there could be major benefit. But, you know,
Yeah, and I hate to take stuff back to my local jurisdiction, and it's, how should I say, it's not pleasing to them, and, you know, and personally, I get blamed for it. And so, you know, I'm not sure what we can do here if all of us have to personally dig through 18 pages to kind of come up with the true cost of this bill that we're expected to vote on. It's not fair to us, but, you know, that's my personal opinion. So, thank you.
So my question was similar, because I noticed that the little graph that we normally have in all the bills wasn't there. So it would be helpful to know what the total cost, again, I support it in theory, but it would be nice to know what the total cost is, you know, of this, because we have a number of bills there that, and they're really starting to add up. So, yeah, so would like to see that. Thank you. Okay. So we
and
could get
Senator
the
Elfrith, I
policy
spoke
person.
with today, She's worked on this pretty extensively. She is willing to walk people through or explain where the costs are or where the benefits are. And there's some other people who've worked on this. There are two people. There's John Griffin and there's the other person's name.
Yeah, he told me he's on a plane today, maybe he can
Okay. We can try to get you some additional, to give a better 10,000-foot understanding of what this bill does and what the financial losses or gains are. And
Yeah.
again, Senator Elfreth also offered, so.
Yeah, and if I could just say that I'm happy to hear that Budget and Tax is willing to contemplate savings, because of those social savings are rarely considered when we're making arguments for, enhanced education and all of that. So I'm happy to see that, and I would love to actually see the savings quantified. And again, I'm happy that that's something that we're going to start to consider, not just an expenditure, but what a savings is. So thank you.
So it's just in processing this stuff. So could we get like an updated fiscal note instead of having lots of words? Have the analysts go through and just do that for us before we vote on this. Is that? I know anything is possible, but is it likely we
No.
can get that?
I mean, they generally don't even do it if a bill is amended. It takes hours and sometimes weeks to do that. And I think some of and again, I can't explain this bill, okay, so let me be
You
very
said
clear.
you can or can't?
I cannot.
You cannot. Okay.
So I'm not, but I think some of the ambiguity is because of, it creates credits and some new markets, and they don't know how, it's hard for them to quantify. I think that's one of the reasons, and you can correct me, why some of the specific numbers in those charts aren't there. But I'd rather have one of the experts talk to you, or maybe we can have someone here next Thursday to do just that, Senator. I don't know, but this probably took them 3 weeks to develop. I don't expect they'll do another one this week.
I will also just to add a little bit of context to the fiscal note process and the reason why some of these bills have a chart and some of them don't. Typically, a bill will have a chart if there's an easily quantifiable expense that is occurring over a number of years. So an easy example is, and the way the fiscal note writers prepare these notes is by reaching out to the agencies, and so they rely pretty heavily on the agency feedback. So a classic example would be is if they reach out to an agency and the agency says, all right, in order to implement this, we'd have to hire 2 people. So typically that chart that you see is the cost of the salaries of having those 2 people over whatever term in the out years. The reason why there's not one in here is because the only real sort of identifiable expense is that study, which is quantified at potentially $1 million. The rest, the bill is mostly, it's a lot of authorizing language. So it's a lot of sort of giving departments different tools and options for different programs. And so it becomes very difficult to pinpoint with any sort of accuracy to sort of attach numbers to that. And so that's why you have to go to the back, which is always where the more detailed description of the fiscal effects would be in a fiscal note, where they'll sort of tease out, what they try to do in those instances is give examples, like, well, if we make this assumption, maybe these cost or these benefits would accrue, but it's not something that can easily be put into a table and sort of kind of done in the out years. So just to provide a little bit more context, I know fiscal notes is, they're a world unto themselves.
Thank you.
And, this happened, I assume they heard it during in-person. We did send a Senator Riley, I hate to put you under the bus here.
That's okay, go ahead.
You may not have been there, or I might have been late telling you. Look, I take all responsibility. I would get notice we're having our hearing today. I'd ask Ms. Stanton to assign somebody, and there's some times it could have fallen through the cracks. So if it is, it's on me.
Mr. Chairman, I understood. It was exactly like she said.
Okay, you're with her. Okay, so,
Great job of explaining my view.
okay. Okay, we will take it up Thursday. We'll try to have someone here, and if we can, we will try to send some contact information with one or two experts, if we can.
The next one, I think actually is going to be a hold too. They realized the bill doesn't quite do what they need it to do. It needs amendments.
Okay.
So Senate Bill 354, Bay Restoration Fund, Intended Use Plans, Privately Owned Wastewater Facilities. Got word there's some amendments coming.
Okay, that's a hold. Shortens our list.
All right, next one is Senate Bill 367, Patuxent River Commission membership. This bill, as introduced, it adds the Patuxent River Keeper as a permanent full voting member of the Patuxent River Commission beginning June 1st, 2022. There are amendments in your packet. Those amendments begin on page 12. The reprint begins on page 14 from Senator Pinsky. The amendments give the University of Maryland Center for Environmental Science, or UMSCES, a permanent seat on the commission. So currently, they are one of the two appointed to represent academic interest, but during the bill hearing, they requested that they be added as a permanent member. It also adds a representative of an organization or unit of local government that engages in watershed management and restoration to the commission. And finally, the amendment makes the bill an emergency measure.
Okay, it's been moved. Is there a second? Second, any objection to the amendments? It came in just for me to get it going, with just adding the Patuxent River Keeper. That was Mr. Tutman, who appeared before us. But as I shared that day, I thought there were some other amendments or other positions to have greater voices from people who have been important people on the commission. So that's why this added that, and by a number of suggestions, I'm making an emergency. So we've moved, it's seconded, no objection to the amendments, discussion on the bill as amended. Seeing none, would anybody wish to be recorded in the negative? Saying not, it'll be reported to the floor. Next.
Senate Bill 414, Baltimore County Board of Education membership and election of officers. This bill alters the membership of the Baltimore County Board of Education by adding one additional member appointed by the Baltimore County Executive. Additionally, the bill alters the number of votes required for the Baltimore County Board of Education to elect a chair and a vice chair by requiring a majority vote of the voting members currently serving instead of a majority vote of the total number of board positions. This bill also makes conforming changes to require the county executive to appoint the board member through the same Baltimore County School Board nominating commission process that the governor is required to use to appoint members. Second, the county executive to fill a vacancy in the county executive appointed seat in the same manner as the governor fills vacancies in gubernatorial appointed seats. And third, a candidate for an elected seat may not be appointed by the county executive. There are no amendments, there was no opposition, and we have received the local letter.
Could you say the last part again, please? That a candidate for the school board couldn't be appointed by the county executive?
Correct. So, for example, if you don't get appointed, you can't go and run. Or you can't be on the ballot to run and then ask to be appointed. You can't use the process against itself.
What if there was only one person running? Couldn't they get a head start and start serving?
Well, it's a hybrid board. I mean, there's appointments, I believe.
Oh,
that-
okay. I thought we were talking about a vacancy.
No. They're just saying in general, a candidate
it.
for an elected seat
Okay.
may not be appointed, so yeah, they can't poach them off the ballot. That's
Thank
really
you.
what it comes down to.
Any objection to this bill? 414, seeing none. Unanimous going to the floor, local bill. Next.
Senate Bill 425, Real Estate Associate Brokers and Salespersons Compensation Payment from Title Insurance Producer. This bill authorizes licensed associate real estate brokers, licensed real estate salespersons, and the business entities formed by associate brokers and salespersons to receive compensation from title insurance producers who work on behalf of real estate brokers during the property settlement period. There are no amendments to the bill. Senate Bill 440, Commission to Study the Healthcare Workforce Crisis in Maryland Establishment. This is a bill that is held. I can explain it once again, but if not, I'll just explain the amendments. Okay, so in the voting packet, we have several, and we have several that accompany the voting packet. So we'll look at the voting packet first, and they start on page 18. These are sponsor amendments. So the sponsor amendments by Senator Bidle remove several positions, including the Secretary of Higher Education, the State Superintendent of Schools. It requires advisory committees to be established. It requires the focus of the committees to include improving and increasing wages and opportunities for career advancement. It requires consultation with the Department of Veterans Affairs on military and civilian issues. That takes care of the sponsor amendments. There is an additional amendment from Senator Washington. Senator Washington's amendments begin on page 22. They strike the Secretary of Higher Education. They strike the State Superintendent of Schools. They remove the Assistant Secretary for Workforce Development. They remove the Executive Director of each Health Occupations Board, and instead replaces the Executive Director of the several of the following boards: the Board of Nursing, the Board of Pharmacy, the Board of Physicians, the Board of Professional Counselors and Therapists. It also adds the following positions: the Director of the Maryland State Office of Rural Health, the Director of the Office of Minority Health and Health Disparities, the Director of the Office of Healthcare Quality, Provost of the Graduate School of the University of Maryland at Baltimore, the Chair of the Maryland Higher Education Commission's Private Advisory Council. So that takes care of Senator Washington's. Senator Riley's amendment begins on page 27, and this amendment makes the bill an emergency bill. Senator Pinsky's amendments begin on page 28, and they affect reporting requirements. So under the amendments from Senator Pinsky, the first report would begin or would be due December 31st of 2022. And they would be due again on December 1st of 2023. It would limit the commission to 1 year, with the termination being, instead of June 30th, 2004, it would terminate December 1st, 2023. You'd have 2 reports, and then it would dissipate. There are amendments. There's a reprint actually included from Senator Rosa Pepp that establishes a work group within the commission for the specific purpose of understanding how apprenticeship programs can be used to kind of mitigate the shortage. So there are 4. And I actually have to slightly correct myself on the sponsor amendments. Give me one moment. I think I may have misconstrued some of the positions, and that reprint is not included, so give me one moment to pull that up. So, contrary to what I said previously, the sponsor amendments from Senator Bidle do not remove positions. They actually add the Secretary of Labor and the Deputy Secretary of Behavioral Health. It is Senator Washington's amendments that remove and add. Sponsor amendments only add. So that is 4 or 5 for your consideration.
Let me ask, I want to do this efficiently. Senator Washington, the 2 that Senator Bidle added, do you retain them or do you dump them?
I would accept those amendments, and in addition, my amendment would be additive.
We can adopt the numbers in a minute, but any objection to Senator Bidle's amendments, the sponsor amendments? Seeing none, the amendments on 18 through 21 from the sponsor are adopted. Okay, let's go Senator Washington's amendment, which gets rid of having someone from all 18 or however many boards, and she restricts it to 5 or 6. And then she adds a few others and dumps a few others, which we went over last week. Yes, Ms. Foxworth.
Senator Bidle amendments, there are some positions that were retained under the sponsor amendments that are not retained in Senator Washington's amendment.
And she's okay with that?
Yeah.
We're going to build on top of each one. The second one amends the first one, wherever there's a supersession, supersedes, we'll take the subsequent amendment. So if Senator Washington sees 1 or 2 things in the aforementioned amendments, we'll adopt it as such, because we've already heard from the sponsor. On Senator Washington's amendments, discussion. Senator Washington.
Oh, I just asked for your, they were thought about, they were discussed with all involved, and I'd like to move forward on it. So, yep, taking the considerations of this, our discussion, did some work to try to accommodate everyone.
Discussion, any objection to the Washington amendments? Seeing none, they are adopted. And again, we're going to have to correct any, the Washington amendments will prevail if, whatever. Senator Riley has an amendment.
Emergency bill.
Okay, any objection? Seeing none, adopted. I suggested the interim report. I think we should be clear, it's an interim report. So on line 16 on page 31, we should make it clear it's an interim report, and then the final one a year later, if that's not, we don't want to have them do it. We want to do the work and get it done and report back to us. Any objection? Senator.
Thank you. So, Ms. Foxworth, I wonder if there's typical language when they say the secretary of or the secretary's designee. I know that I've brought this up before, but what happens when there's a new secretary and a new designee? I mean, would there be a new person, presumably, because the person sitting in that chair is no longer in that chair? And how do we need special language to envision that?
Transfer, when it's a new election, when there's a new appointment, it kind of automatically maintains that change in role.
Now that the Secretary of Health, on page 29, line 12, the Secretary of Health designates the chair. So then if there's a new Secretary of Health, would there be a new chair potentially if the chair that she or he, well, that Secretary Schrader appointed or something that, I mean, there's just so many.
It changes with the new post. So my thought is that
I'm not trying to make it
the
complicated.
chair will be retained throughout the process. as
That's
soon-
if it's extra, if the chair is external to the government or the administration.
So the first secretary that is in effect when the bill is amended or when the bill is enacted will create the chair. There isn't any language about how that chair will be reappointed, redesignated, or removed. So the thought is that that chair that was in place when it was enacted will maintain through the transfer.
I have been through a few of these, and Ms. Foxworth is right, that if a position changes, the person changes. In other words, on the Climate Commission, it was Don Bosch, and he retired, and Peter came on, and Peter took that seat on the commission. So it's whoever holds it. So in terms of the new secretary, when he or she takes their position, they would have that seat and could select a designee. I'm not sure whether they, in fact, continue to have the right to designate the chair. They might be happy to leave the person in place. With all due respect, have either of you had this situation on other legislation? You've been around a bit. Do you know what the policy would be on if the person who selected the chair is no longer in place? Does the chair remain, or?
As long as the person who they selected remained on the committee or the commission, I believe that they would still be the chair until, for example, if they had a 1 year, they choose the chair, they have a 1 year term, that person remains on it, then they can remain the chair. I don't think just because the person who's appointing them has changed, it means that the appointment changes.
We adopted the first 4 amendments. Now, Senator Rosapep has an amendment that he has sent forward to us, sent downstairs. It's a freestanding reprint. Does anybody want to proffer it? Anybody want to proffer the amendment? Going once, going twice? It's freestanding. It's unofficial copy of Senate Bill 440 at 5 p.m. March 1st. It's a reprint, about 6 pages, 5 pages. It is not in the packet. Thank you.
Yet, are we still on amendments?
Allows for subcommittees, but it doesn't start specifying who's on it and what they are. And we've adopted the board itself, the commission itself. So unless someone wants to proffer it, I don't want to prolong this. See no one proffering it. So we have the bills amended in front of you. It is up for discussion, debate. Senator Gallion.
Yeah, so I just wanted to make sure that this group, is it going to be focused on solutions, or is it going to be looking more at trying to identify problems? Because identifying the problems, I mean, you can do a Google search and see a ton of reasons why there is this issue. So if we're looking to make the best use of our resources, I think if this group's not looking at solutions as their primary focus, I think would be misguided. So can somebody just clear that up for me? Is this going to be a solution-oriented group or just a problem-finding group that we can find on Google?
Well, the bottom of 29, I mean, let's put aside intent. On page 29, line 26 through line 15 on 31. Let's just take a minute to review it, okay?
Okay. Now, are you looking at which one are we looking at now?
I'm sorry, the regular packet, the full packet, page 29 at the bottom. The charge to the commission starts on line 26 on page 29. So let's read the bottom of 29, 30, and the top of 31. Let's just people review it for a second.
One that has the voting list on the front. Look at me. The voting list on the front.
No, the thick packet.
Jason, you're not in it.
No.
He's not in it.
Do a lot of examining, but if you look at the last page, it says they'll submit a report on its findings and recommendations. So I think inherent in that, they're recommending solutions based on what they researched. I mean, that's the way I read it.
3 for short-term solutions on line 8, and then you get down to 32. What changes are needed to enhance incentives? Number 6, examine ways to facilitate career advancement. Solutions for rural health. I mean, I think it has some. Senator, please.
Same thing that Senator Simoneer said, that, you know, it is very explicit at the end that it states recommendations, and I think I agree, the problem is been well documented across other states as well. I think what they're trying to do is really come up with specific solutions that are tailored to our state, and that's where the recommendations come into play.
Chair, I didn't think we needed a whole new work group and stuff, but I wonder if on page 30, 31, lines 32, 33, examine what changes are needed to enhance incentives for individuals to enter and stay in the healthcare workforce in the state, including to changes to high school curricula. I think we could put right in there, apprenticeship programs or something. And then it goes on, mid-career transition programs, state tax incentive grant programs, enhanced benefits, blah, blah, blah. I think it fits there, and I think we could do 2 words without expanding the group or its population. So that's a suggested.
Madam Vice Chair, could you repeat what you're suggesting and where?
If you start on lines 32 and 33 on page 30, the very bottom of page 30, and then go to page 31 at the very top,
Right.
I think we could insert the words, and Ms. Foxworth, you would know the right words, but something like apprenticeship opportunities or apprenticeship programs or something, just 2 words.
Any objection? Seeing none?
Done.
Another amendment, done.
Yeah, thank you. Last time we discussed this, the Vice Chair mentioned instead of veterans being consulted, they're put on the group. So I'm not sure if you would proffer that amendment to, instead of consultation, we have a Maryland Department of Veterans Affairs, so we could add them to the list of, oh, I have no idea, but I just remember our conversation from last time, so. But it's in the language for consulting the veterans groups. 20? 21? Okay.
I don't know if you're talking about a list on the commission, but the one that gets closest to where we are now can be found on 23. We haven't aggregated all the amendments yet. So it would be Senator Washington's amendments which gets us closer. It's not exactly the makeup because there are a few changes. So, Senator, where or what would you specifically change or amend?
So, so right under, let's say, Chair of the Maryland Higher Education Commission, Private Advisory Council, or designee, you could add the Secretary of Maryland Department of Veteran Affairs or a designee.
Okay, the senator has offered.
Yeah, and why that's important is, I think the intent of the bill sponsor, there is a tremendous potential pipeline from folks coming out of the military into the civilian world. You know, there's a large medical corps in all branches of the military. And so if we bring them directly to the table, that could be part of the solution.
Discussion, is there a second?
Second.
Okay, discussion. Senator, you said the Secretary of Veterans Affairs designee
Or,
or designee. Okay. I mean, I'd just like to make sure the designee had experience in the health field. I assume the secretary is not going to do it. I mean, if this is really a solution-focused group, and I hope discussion's not at 30,000 feet.
you know, well, it's really not, could I jump in?
No, please.
Yeah, it's not because, you know, a large, a big mission of the department is to help transition veterans in transition from active duty back to the civilian world. So they're quite involved with veterans who are engaged in career change. And so they have folks there who definitely work in that area. And so it wouldn't be just someone random who they can place on this board.
Okay. Senator Washington.
Again, I get the intent, so I was trying to see if it could be accommodated, but I'm looking at the office, so is it the Department of Veterans Affairs? Is that what you're referring to?
Yes, the Maryland.
So the staff, the directors I see are outreach and advocacy. There's a veterans home program. There's a cemetery memorial program. And then there's services and benefits. Which of those people, where do those, does the outreach to the medical community go?
Well, it's most likely services and benefits. It's not focused just on the medical part. It just work with all veterans, whatever career fields they're in.
Okay.
So that will be in their purview.
I just want to have someone selected by the secretary who has experience in the medical field or the transition, or the experience in transition veterans.
Sure.
I like someone who's really value added. And I assume it might be, but it's a big operation, and I don't know.
Well, it's not that big. Yeah, they're not that big. It's not that a large agency. But I mean, I was looking at the Secretary of Commerce or the Secretary's designee. So we didn't really get too deep with the, say, Secretary of Commerce as far as put this person on. So I was thinking in that line.
Okay, any discussion on the amendment to add veterans affairs? Same time as adopted. Further discussion on the bill as amended? would anybody like to be recorded negative, saying
Hold on. Senator, right here, right here. Did we decide that we were going to qualify this member by making them experienced in the healthcare field? No? Okay. Senate Bill 513, Health Occupations, Clinical Nurse Specialist, Prescribing Authority. This bill defines the practice of a clinical nurse specialist, it codifies the scope of practice for a clinical nurse specialist to include granting prescriptive authority through the Board of Nursing Regulations. It includes the clinical nurse specialist as an authorized prescriber. There are amendments included in the packet. I'm going to find the page. You said, what page did you say? Page 32, it looks like. And so these sponsor amendments remove the ability of the CNS to order, perform, and interpret diagnostic tests, and instead authorizes the CNS to only order diagnostic tests and to use the data and evidence and the results in the treatment of patients. There also is a chart that accompanies this alongside the myriad of other papers that I handed to you all. And so on the chart, kind of a comparison between CNSs, clinical nurse specialists, and nurse practitioners with their educational qualifications, the certifying bodies, in the event someone wanted to do a little more research, and their general scope of practice.
So, yeah, I'm going to call on you in just a second, Senator. They're obviously asking for prescription authority, prescribing authority. Numbers of nurses and PAs and other groups have it. They, of course, made the case that they are similar, but it's up, obviously, to the will of the committee. I'm going to start with Senator Lamb, then I'll go to Senator Riley.
So I had a question for council. I guess I'm looking at this chart and wondering who compiled the chart, just so that I have a frame of reference here.
No, I did it
Okay.
through looking at the national kind of certifying agency for advanced practice registered nurses and the information from the Board of Nursing and the statute and regulations.
I mean, I think there are, and it came up during the hearing, some differences in their education. So while it says that they have a graduate level of education with the advanced practice nursing program that the board recognizes, there are some, I think, distinctions between the training that they receive, because if there weren't, they would also not have a different title. I think there are some distinct differences, not only their training, but also I think what they can do. And I think some of the folks that testified did convey that some of the clinical nursing specialists are more focused on kind of the broader management of healthcare teams, as well as some more research on kind of research-based type practice, and then more on kind of the educational piece of it. And I think that that can lead to confusion because the title is certainly different. I mean, there's, even though, you know, I think all of us are familiar with nurse practitioners and physician assistants. I think when someone says a clinical nurse specialist, you know, someone who's not medically trained or even the lay public may have some confusion what that actually means. Are they equivalent to an NP, or there's nurse in the title, but there's nurse in the title practitioner? You know, folks are familiar with what an NP does. They are kind of like a provider, not certain with the CNS piece. And I think that can generate a lot of confusion. You know, I think what the folks that had come up had said is that there's not much difference. But if there's not much difference, why is there a difference in the title, as well as some of the training that they receive as well? So, you know, it gives me some pause, because I don't think when I asked the question as to what exactly their differences in their training were, it wasn't super well articulated to me what those differences are, except that it's a little bit more focused on kind of the academic program and research and kind of management theory as opposed to kind of the practice of it.
Thank you very much, Mr. Chairman. Alongside Dr. Senator Lamb, got a note that the Maryland Psychiatric Society and the Washington Psychiatric Society filed opposition to the bill to concerns of lack of pharmacological training for the psychotropic drugs which impact synamic health when attempting to regulate mental health. To the staff, if this bill passes, they have unlimited drug prescription authority. Is that right?
For the board to determine. And that's similar to how it is with nurse practitioners. It isn't directly codified, but the board says that with nurse practitioners, they're only able to do Schedules 2 through 4, which is the full gamut of prescribing authority, because Schedule 1 drugs are like illegal street criminal drugs. So they'll be able to do the full gamut, but it hasn't been itemized and certainly hasn't been codified yet on what the specific schedule is.
I also believe MedChi may be opposed to the expansion. So I have some reservations, Mr. Chair. Thank you.
On the list of witnesses, it shows the Nurse Practitioner Association of Maryland favorable, although I can't find their testimony, although I'm probably overlooking it. I mean, does it say anything that the people they're being compared with think it's fine? I mean, does that hold any water or not, I guess is one question. I just want to hypothetically throw that out. If they're being compared and are very close, and somebody showed a chart, I don't know if it's accurate or not, would they want another comparable skilled professional having the authority that they already have? Or do they making that judgment based on they think it's in safe hands? And obviously the nursing board also does support it, and I don't know if they're going to say yes to anybody who falls under their board or whether they look at this critically. And I'm just posing these questions. I don't have an answer. I think I saw Senator Washington's light and then Senator Ellis's light.
To the question that you posed, we do, because we take into consideration what MedChi says, or, and when they are, well, they usually aren't opening it up, but occasionally they do. And so, like, if nurse practitioner, we should consider it. I mean, I was originally more thinking, that maybe not, but it does give me pause that they are saying that they believe that these people are qualified. So I do think we should take it into consideration and better understand why they believe that's the case.
Senator Ellis.
Thank you, Mr. Chairman. So generally with this, I would defer to recommendations of Dr. Lamb. I just want to say, though, my mom, my late mom, was a psychiatric nurse, and her last job, she was in charge of a mental health clinic in Georgia, and she was an RN, and so, she worked closely with prescribing and dispensing, definitely, these medications, and I know in their training, nurses training, they are trained in pharmaceuticals and all kinds, and they have specialized, just like in all fields, specialized nurses who, like my late mom, was specialist in mental health area. So she understood all of those areas, and then of course, there was physicians there who actually work with her. But I know the knowledge is there with nurses to actually do prescribing. So, of course, we have specialists in every field, and so you have mental health nurse, you might have pediatric nurse in all these areas. Not everyone knows everything, but you would think if we authorize them to do this, I mean, they have professional responsibility to stay within their lane of specialty.
Senator, before I call on Hester, your mom had clearly dispensing authority, and I don't know how long ago she practiced or when she stopped. RNs didn't always have prescribing authority, and I'm curious to know whether, if you remember, whether she could actually write a script when she was practicing.
I wouldn't go so far as say she did. I didn't pay that close attention to whether she, she really had it, to be honest. But I know what her job was, so I wouldn't be able to truthfully give you a direct answer with that. That's why I said I would defer to Dr. Lamb with this recommendation.
Let's go to Senator Fry Hester and then back to Senator Lamb.
Thank you, Mr. Chair. I was just reading through the Board of Nursing testimony, and it's, in terms of a letter of information, it's pretty favorable. But they do point out that 39 other states currently allow independent prescribing. So it seems like right now we're in the minority of states that don't. And then they request an amendment on page 3 and 4, which I'm not sure that we've taken. So, and council says we have not taken, but I don't know, I feel like we're so short-staffed right now that really doing everything that we can to support this profession is really, really important. And I guess I do have a question. The question would be, what would the amendment that they're proffering do, council?
It would clarify that it's not just advanced practice nurses, but advanced practice registered nurses, and which is more of a technical amendment in saying that the advanced practice registered nurse with prescriptive authority applies to all of those APRNs with prescriptive authority under Title VIII, which is the Nurses Code, instead of the 2 that the bill mentions, which would be, as it stands, nurse practitioners, and what this bill is trying to do to expand it to CNSs. So in the event nurse anesthetist would have wanted this prescriptive authority, if this amendment was taken, it would kind of broaden it to include that in one fell swoop as well. Instead of going to the particular section of the code that applies to each APRN, it would, give broad authority under the entire title to those APRNs with prescriptive authority. Which,
I hear that, it would cede some of our authority to the board. This is, as it came in, it's narrow cast. But as I hear Ms. Foxworth, I think it's to give them a little more authority, because there's another bill floating around on
Right.
nurse anesthetists.
so it wouldn't expand the authority. It would just simply say, in the event nurse anesthetists have are granted prescriptive authority, or clinical nurse midwives are given authority beyond what they already have under the code, we wouldn't have to go back and amend that each time with each change. We wouldn't have to amend that section. So it's not necessarily substantive, it's more of a technical convenient change.
Yeah, me too. Thank you. Yeah, I see what you're saying, because first I didn't understand. So in the current health article under 8-101, they have already defined advanced practice registered nurse as being a nurse anesthetist, a nurse midwife, a nurse specialist, and a nurse practitioner. So all those 4 are already in code defined as advanced practice nurses. And so it sounds like they're saying that, hey, we've already said that these are all parallel people, that these are all professions that can be considered advanced practice registered nurses. So let's just go ahead and, add that now. So it's not adding any other kind. It's just referring back to existing code.
Momentum for going ahead with this, we can take that issue up. And I don't know where people are, so Senator Lamb.
Yeah, so thank you. I did want to address some of the things that were brought up. I mean, I think currently only nurses do not have prescribing authority. So they can't actually write a script or prescribe a medication to someone. That is only reserved for advanced practice providers, or APRNs, who have the authority to be able to, and we've given them that authority, for nurse practitioners, for physician assistants to be able to actually prescribe medications. And they have additional levels of training to be able to do that. And it's tailored to be able to diagnose and also to treat and prescribe. And so I think there's an important distinction there. Nurses can administer something that an advanced practice provider like an NP has prescribed to someone. The nurse can actually administer the drug, but they can't make the decision to do so, and I think that's an important distinction. When we give someone the authority to be able to write a prescription, it's for any medication, just like when FDA authorizes or approves a medication for use, people can use it off-label, whatever else. And so I think the caution that's been expressed in some of the folks that have brought up in their written testimony is that these folks would have the ability to also prescribe anything, including psychiatric medications, including, I think, as Senator Raleigh was saying, medications that can have a lot of other systemic effects beyond what may be limited to that organ system that they're treating. And they may be an orthopedic CNS, but they would still have authority based on this to also prescribe medications for mental health concerns. And there's no limitations there for that. And given some of the concerns that we've had with opioid issues and whatnot, I think it gives me some pause as to whether that's the right direction to move or not. And when it comes to needing to increase our healthcare workforce, I'm totally for that. I understand that we have a shortage of healthcare workers. But I think it also needs to be balanced with the fact that we want to make sure that we're expanding this to qualified personnel. And I think the CNSs have the ability to be able to administer and to be able to do some of the work that they're doing in healthcare management, research, academic work. This is, I think, a little bit beyond that when it comes to being able to prescribe that may not be fully in all of their training that they've received. And so, I think that prescribing authority, which is really what they're seeking here, is important and unique in its own way.
So so it looks like, I just have a question. So it looks like a licensed dentist is an authorized prescriber, and a dental hygienist has prescriptive authority. So if we give those two prescriptive authority, and certainly if you're talking about opiates, a lot of the source of that certainly comes from, well, anyway. So I don't see, in fact, I think a registered nurse specialist has more training. I was just looking at what they train. They do get trained in pharmacology, et cetera. So I'm moving towards, Mr. Chairman, thinking that we should do this. Because again, if we think a licensed dental hygienist has the ability to prescribe, I think there would be an error if we didn't allow a clinical nurse specialist. But if you can clarify what that authority
Sure,
is.
yeah, so I'm happy to yeah.
And if I could.
Sure.
When nurse practitioners, who some are comparing similarly, sought prescribing privileges, do you remember or recall whether MedChi supported that or opposed it?
I don't remember because it predated, I think they've had prescribing authority for a while for nurse practitioners.
Okay.
So
I'm
it
just
predates
curious
me.
to know whether they wanted to limit prescribing authority to other parts of the profession other than themselves. And I don't want to use that as the benchmark, but it bears a little on this. But anyway, please answer Senator Washington's question if you could.
Yeah, I think the difference there is that dental hygienists are practicing under a dentist. And so when they're doing this type of work, or they need to administer Novocaine or give an antibiotic for someone because they're going to be going through a dental procedure, that's with and under the oversight of a dentist. For these APRNs, the advanced practice nurses, they have the ability to practice fully independently of anyone else. And so, you can go in, see a nurse practitioner in the clinic or see a physician's assistant in the clinic, not even have to see a physician, and walk out with a prescription. And so there's no need to have to formally review things that they're doing with, a level up of review, whether that's a physician or a dentist or whatnot. But advanced practice providers can practice completely independently and have the prescribing authority to do that.
So what you're saying, so that I understand, so you're saying that even though it says that any licensed dentist, licensed dental hygienist with prescriptive authority, I don't see where it's saying under the supervision of a dentist. I don't see that codified anywhere. Is that
I mean, I'm
somewhere?
not familiar with that exact part
Well,
of the
this is
statute.
the bill,
but-
this is the bill that we're dealing with, and it, so again, if a licensed dental hygienist can prescribe, I think a clinical nurse specialist should be able to prescribe.
I mean, I think
It
there.
also has podiatrists, veterinarian,
Podiatry physicians.
yes, no, apparently not.
A non-physician, but.
A non-physician, a non-physician licensed podiatrist can prescribe. So,
But I think, just in my opinion, is I think
Yeah, sure.
their training is a little bit different. And so the focus of the training that the CNSs receive, I think,
Right.
is a little more focused on kind of healthcare management, administration, research, and kind of the academic program. And I think the training is different because otherwise they would be called a nurse practitioner itself. There's something different there.
right, but again, a licensed dental hygienist can prescribe. And so if you're going to talk about, I think it's part of that there's a skill set, an advanced skill set that's necessary. Wouldn't you agree that a registered nurse who has moved into management, he or she probably hasn't done that all of their career, and they receive the training, we should be able to prescribe if we've allowed these, a dental hygienist to prescribe. So it just doesn't, we're being inconsistent. So, thank you.
Thank you. During this conversation, I tracked down that map that, I guess it was referenced in their testimony, and it's the independent prescribing map. And it looks like there's two levels of prescriptive authority. Which I think you guys were talking about. There's independent, where there's no requirement for written collaborative agreement, no conditions for practice, you're totally free to do what you want. And then not independent, where a written agreement exists that specifies the scope of practice and medical acts allowed with or without a general supervision requirement by an MD, DO, DDS, podiatrist, or APRN. So I wonder if there's some way that you can, it looks like Virginia has this not independent prescribing authority. So I'm wondering if there's a way to split the baby in terms of doing something like that.
Yeah,
Can't do, yeah, I
Look,
think that would be fair.
there are alternative ways to resolve this. I don't know from the advocates if they'd rather have no bill or part of the bill. I'm fairly agnostic on this. I've gone back and forth. So, but it's up to the committee what we want to do. Sure. It's been suggested we hold the people who want to move this, and again, I don't know where the votes are on the committee. I haven't counted. But if you want to check with the advocates and see, one, if that's a possible solution, and then if there's 6 votes for it. So we'll just hold it. Any objections? Saying none, it's a hold. Next. You got two more to go, folks.
Senate Bill 541, Natural Resources, Maryland Park Service and State Parks, Alterations, the Great Maryland Outdoors Act. This is another bill that is coming to us as the secondary committee. So there are amendments in your bill packet, starting on page 33 from Budget and Tax. These amendments are more extensive than the last package of amendments that we looked at. And again, there is a reprint that is separate from the amendment packet. Should be somewhere on your desk. Again, Senate Bill 541. So this bill makes various changes to state law affecting the Maryland Park Service, parks in the state, and land conservation relating to 1, funding for parks and other land conservation, 2, park staff and volunteers, 3, management of parks and park infrastructure, and 4, new parks, amenities, and other considerations. This is the bill that was based off of the recommendations of that State Park Investment Commission So even though this committee did not have a hearing on the bill, that briefing sort of covered a lot of the points that are incorporated into this bill. So the budget and tax amendments, I'll walk through as best I can. First of all, the amendments substitute the term ranger for references in the bill to Park Service Associate. That's throughout. It also specifies that the asset evaluation that occurs under the bill within the state park, so this is the reviewing of sort of what does the state have now and what condition is it in, should include park structures, infrastructure, and landscapes. That's on page 4, if you want to follow along in the reprint. The amendments require the Department of Natural Resources to include estimates on preservation and not just restoration in their system-wide survey of historic resources. That's on page 5, line 24. Clarifies that the Park System Capital Improvement and Acquisition Fund, which this is the fund that is set up in the bill to sort of deal with maintenance issues, critical maintenance issues at the park, can only be used for state park projects. Right now it just sort of said state projects, but the intent is just to mean state park projects. Authorizes the Department of Natural Resources to use $5 million for historic preservation in coordination with non-governmental organizations. It's on page 9, lines 3 and 23 of the bill. Establishes the Great Maryland Outdoors Fund within the Department of Natural Resources to support outdoor recreation and authorizes the governor to include up to $3 million in the budget for the fund. This is on page 9 of the reprint. It's new language. It's a new section 5-222. The amendments require 2 of the 5 positions that the bill adds to the acquisition and planning within the Department of Natural Resources to be filled by assistant AGs that have real estate experience. It's on page 10, line 16. It adds 2 citizen members to the Oversight Commission. So the bill sets up, it replaces an existing commission with a new sort of, it calls it the Parks and Recreation Commission. The amendments add 1 member appointed by the Senate President and 1 by the Speaker of the House. That's on page 12, line 18. Amendments change the staffing of the Oversight Commission from the Department of Legislative Services to be the Department of Natural Resources. That's on page 12. Requires the Department of Natural Resources in its annual report to the Oversight Commission to include the condition of the state park system's natural and cultural resources. It's page 13. Clarifies that the comprehensive long-term strategic plan that's developed under the bill must include the feasibility of establishing new state parks through both land acquisition and the redesignation of existing lands, and that the plan must also include plans for trail connections. It's on page 16, lines 2 and 5. The amendments add intent language around creating a state park in Prince George's County. That's on page 18. The amendments authorize the Department of Natural Resources to enter into memorandums of understanding to create what they call partnership parks with local governments, nonprofits, or bi-county agencies. This is on page 19, lines 18 of the bill. It also adds intent language to ensure that if the state acquires Carr's Beach, which is sort of a historic beach near Annapolis, that it should become a partnership park through the memorandum of understanding process that I just described. That's on page 21. Reduces the payback required under the bill to the Maryland Agricultural Land Preservation Fund by $2 million, so that it would go from $18 million to $16,565,469. It's on page 21. In sections of the bill dealing with workers' compensation, it strikes all new occupational disease presumption for park rangers, with the exception of language related to Lyme disease. So that's the only one that it's holding on to, is the presumption that park rangers' Lyme's disease would be an occupational disease. That's on pages 27 through 29. It extends the $1 million of state, of funding for the state lakes that was going to sunset this year. It extends that for 3 years. If that sounds familiar, it's because that bill on the state lakes funding has been before this committee before. That's on page 32. Requires reporting on the reactivation of Fort Tonalloway State Park. That's on page 32 as well. And finally, the amendments move the bill's effective date from July 1st to June 1st.
Where is Fort Tonalloway? Charles County, I don't. Never heard of it.
It is an undeveloped Maryland State Park located near present-day Hancock. Does anybody know where Hancock is?
Yeah.
Yeah,
Hancock's in
Oh,
Western Maryland.
there we go.
on your way to Rocky Gap.
There you go.
When you have 8 years of Speaker Cass Taylor, you know where Hancock is.
Yeah, everyone in B&T got a park. Senator Gallion.
Mr. Chair, I was the EHE person that went over for this one, so I was at that. Is it all right to,
Did you get a park?
I had a seat
it
right
seemed-
on the end,
it
though. I
seemed-
felt like I was the 14th member of B&T for a few minutes.
Well, you should have demanded a park. There are a few others in here I've noticed.
But anyhow, so just the genesis of this bill, especially with COVID, we saw so many people going to state parks. A lot of them are overcrowded. They don't have enough staffing. So one of the things that this would do, and April, correct me if the amendments changed any of this, it would add up to, I think, like 100 potential new employees for DNR, would allow them to, expand the parks out. One of the things I really liked about the bill, and Senator Ellis and I sit on the joint subcommittee for ag preservation and open space. And we had a recent bill in here a year or two ago where we took goals for ag land preservation and basically pushed them off in the future because we weren't reaching them. And the reason was lack of funding. So this bill would add a good bit of funding to MALF, which is a Maryland Ag Land Preservation Fund, and Project Open Space. Now I saw, so anyhow, this bill has a real kind of Teddy Roosevelt feel to it, as far as the state parks, which is something that, a bunch of people could enjoy and get a lot of enjoyment out of. So, I appreciate getting to go sit in on that. My only question on the amendments, on page 21, it cut back that Maryland, I believe the Maryland Ag Land Preservation from like 18 million to 16. My question is, what's it funded out now, and is that 16 an increase over the current funding, or is that the total funding?
That change is contingent on the passage of Senate Bill 942. My understanding is that change was by request of the Farm Bureau. I don't have all of the details about it aside from that. So Senate Bill 942.
Right. I was just curious, for that line 14 and 15, it cuts that from 18.564 down to 16, and I just was curious about that. I didn't.
Yeah, I mean, I can try to get more details about it, but that's the sort of preliminary that I got, was that it was.
So trying to preserve open spaces, that was a really good point that during that hearing, to, have an increase of funds so we can get closer to reaching our goals of, how much undeveloped land we can have. So, I mean, 2 million doesn't sound like a lot. I was just curious. In the whole grand scope, it's a lot, but in the grand scope of this bill, maybe they were just trying to shift some numbers around. I don't know.
Okay, Senator Ellis.
Yeah, thank you, Mr. Chair. So I'm looking at page 22 of the bill. It talks about $10 million to the Corporation for the Next Generation Farmland Acquisition Program. Does anyone, Ms. Morton, know about that particular provision for $10 million to acquire farmland?
Your seatmate might know.
Okay.
So the Next Gen Ag Program, basically what that does, it's funding, so if you have a newer farmer that meets certain criteria, they got age and years in the business and whatnot, they can purchase a farm that does not have an easement on it for ag pres. So if it's a farm that still has all the building rights, that farmer can go and get this money that would help them go to settlement, and they can purchase a farm within a certain amount of time that they would have to get into a preservation program. So it's basically a way for farmers to buy land with some help up front that they'll have to pay back to buy ag land that's not already in some sort of ag pres program.
Yeah, and so the corporation there, it's the appropriation goes to, that's Marbidco, the Maryland Agricultural Resource Base Industry Corporation.
Yeah, you got it.
So it's an economic development corporation, but so the money goes to them for the purpose of lending out under this next gen farming program. That's what that is.
Yeah, okay, so thank you for that indication. So I'm looking at the title of this bill, Natural Resources, Maryland Park Service and State Parks, the Great Maryland Outdoors Act. So the issue with bringing more parks, more access to parks for the general population, and I see $10 million tucked into this very expensive bill. And by the way, it had a nice chart with the fiscal note, so I was happy about that. But I look at this, and there's $10 million tucked in for what I consider is unrelated to creating more parks. I mean, we have a lot of farmers and farms in my district, and that's very important. But if we're dealing with parks, I think we should put this money into parks in Waldorf instead of farmland, parks in areas of Prince George's County, more parks in the area of Baltimore City where people have been deprived historically for open space. And, you know, historically, and as in my bill testimony with pro open space, since 1969, that money has been used for agricultural land purchases, for woodlands in my district, I know, and throughout the state. And so if we want to be serious about creating more parks and open space, to tuck in this kind of money into this bill to create more parks, it's kind of like fooling the voters, and I'm not into that, you know, and maybe that's a little bit too strong, I know, but we need to focus on this bill, on parks, access to the public to parks, especially those so many people deprived of access, and take care of the farmers in another bill. But this bill is to take care of folks with open space, with more parks, more access to parks. And so just wondering why that would be tucked in here like that. Okay. Thank you.
I can offer from Senator Elfreth, if you'd like. She's not clear what the $10 million reference is, but she said there's, what you were asking about was part of the POS program, open space repayment. They wanted to keep the agricultural side of the repayment whole. That's kind of direct quote. I don't know if that's helpful.
So the 10 million is to repay?
Program open space.
Okay.
Would it be helpful if we asked Senator Elfreth to come join us? Mr. Chair? She's willing to do it. I don't know whether we want that or
That
not.
kind of,
That's,
So I see farmland acquisition. It doesn't say anything about repayment. It says acquisition. Acquisition, in my world, that means you're buying something new. It's page 22, line 9 through 12. Senate Bill 541. Make sure I'm on the right bill. Correct me if I'm not. Page 22, line 9 through 12.
Corporation in this category is what?
Can I answer that? Sure. So, from sitting on that hearing, I think there's a lot of components in there that would help with park spaces and stuff like that in all different areas. But I think the bill's kind of almost has two parts, and it's that adding, these areas to some underserved areas from my understanding. But it's a broader where it's just trying to preserve open spaces and keep the development from certain spaces. So it's kind of, I think, trying to do both things.
It's because the bill is moving some money around. So, yeah, on page 26 of the bill, there was already language requiring in certain years the governor to include appropriations to Marbidco for the next gen farming land. This, because it's, I think, and a lot of this was, I believe it's money that for a number of years, the state was not, so the program open space and a lot of our parks funding comes from the state transfer tax revenue. And for a number of years, the state was not using it for that purpose. During the last sort of recession, a lot of that money was being diverted to the general fund. So what has been happening in recent years is the state has been paying that money back to programs that were sort of underfunded in the past. This is sort of taking some of that, the big picture, some of what this bill does is takes that kind of parks money and funnels it into sort of two main pots of money for parks. There's a critical maintenance fund and the capital improvement and land acquisition fund. And then some of the other things that are happening in this bill are just sort of to accommodate the diversion of that funding into these new funds that are being set up. I will say that, so Matt Bennett, who is the counsel upstairs, might be able to answer some of these budgetary questions better. Would it be valuable to invite him down?
If he's available, we just were joined by the sponsor, and we don't always bring sponsors back down, but since we're second on this and don't have as much knowledge, the Senator Elfith may give us some context of what role parks, what role rural farm acquisition land, how that fits together. But Senator Fry Hester, do you want to? Okay. Please come forward, Senator. And again, we don't do this for every bill, but because it's complicated and we're second. The question came up about the investment in the Next Gen Farmland Acquisition Program and how that fits with redeveloping, rebuilding our parks. And Senator Gallion answered part of it. He was there for the hearing.
Yep.
And I think he feels he's the 14th member of B&T, but I hope we can hold on to him and keep him here.
Okay.
But the question came up of the balance and it's been explained about open space and protecting open space, so.
Yep, I'm happy to, and this is a budget question because we use two kind of pots of money to fund the bill. One of which is the forward funding of the program open space repayment that we owe, which is scheduled out in the budget to be paid from now until 2028. So we just forward funding, we scrunch that up. And that still runs through, and I know you know the formula well, Senator, still runs through the POS formula, two pieces of which are rural legacy and MELF. We felt it was important to keep those two whole, but utilize the rest of the formula, which I think we can argue is for acquisition, it's for access, to pay the park. So it's a little bit odd, but we thought for the purposes of parks, we would take all but those two ag pieces of POS. Does that make sense?
Thank you. And I apologize for us working you so hard today.
No, I sprinted here, so I'm out of breath, sorry.
Yeah. So I understand what you just said.
Okay.
And looking at the language on page 22,
Okay.
line 9 through 12.
Yep,
And I just want to kind of focus on that little piece
Yes.
right now. And
that's the
so-
forward funding, yep.
That's forward, yeah, forward.
Yep.
So it says for acquisition of next generation farmland. So when I see the word acquisition, that means to buy something new instead of, say, repayment for something or to fix up something. So that is going forward in fiscal year 2024, from what I would understand just from the word placement, is to buy new farmland to put into the agricultural farmland acquisition program.
Yes, because that's what the money was intended to do as it flowed through the formula. Again, we took everything we thought we could frankly get away with and put it into parks, but the two ag pieces, we felt strongly that we needed to preserve for ag. But we're just forward funding that in fiscal '24. And I appreciate the language is kind of confusing because it talks about acquisition, but it's about paying back the repayment the state owes the program.
So this is not to buy new land. I'm sorry, Mr. Chairman.
And it's the staffer from Budget and Tax, if you don't mind, Senator. I'm sorry?
Thank you, Bennett. Yes, the senator is correct. All right, the formula, so the formula originally would have had this money going to Marbidco through the repayment that was put in place a number of years ago. The bill turns off that repayment, and then this provision tries to keep Marbidco whole because they were supposed to have received this money under that repayment, which would have been transfer tax money. Here, that money's being replaced with the general fund appropriation in fiscal '24, so that Marbidco is just going to continue to get what Marbidco would have gotten under the old POS fund repayment formula.
Thank you. Thank you for the
Thank you, Mr. Chair. I was just, where was it? On pages 22 and 23 of the bill, and I actually talked to the sponsor about this. You know, I know that procurement has had issues on a number of things, and with this much money coming through, we want to actually make sure that our Park Service is able to spend the money that they're given.
Absolutely.
So I noticed that we had added the $100,000 for procurement contract. The preceding two lines stay at, or, you know, at the bottom of page 22 and the top of page 23 stay at $50,000. And I just wonder if we should bump those up to $100,000 as well.
So the current law has it at $50,000, and so the bill does double that to $100,000.
In line 4, but not in lines, the bottom of page 22, it's still at 50, and then the top of page 23, it's still at 50.
That might be a technical question, Matt.
That's current law, so
Right.
the bill is just trying to address DNR here, and that's being inserted there on page 23, lines 6 through 8. The bill is not addressing other units of state government, which is what A1, what is that, page 22, line 32. Those are other units of state government. That's current law. The bill is not trying to affect how other units of state government work. It's just trying to deal with the Department of Natural Resources.
I see. Thank you very much. That's helpful.
Other questions or debate? Senator Gallion.
Since
we have you here, I had a question earlier.
Okay.
On page 21, maybe you can explain this through the formula and all. It cuts on line 14 and 15.
Yes.
What's the reason for the cut of $2 million there?
Because there's a bill, and I don't have it in front of me, but my staff will text it to me in a moment. By request of the Farm Bureau, there's currently a bill for next generation farmland, or farmers, urban agriculture, that calls for $2 million that was counting on the MALF repayment formula. And so this bill says if that bill passes, instead of 18 million going to Marbidco, 2 million of that would go to the urban agricultural program, again, by request of Farm Bureau.
Okay, that's good. That explains that. Thank you.
And Senate Bill 94.
And is Marbitco having their next retreat on St. Croix in the Caribbean? Give them a lot of money. Senator, let me get a Senator Washington back to Senator Hester.
Thank you. Again, thank you for this bill. I think I was seeing there's 70 million going somewhere. What is that?
Yes, so the bill as amended
Okay.
would have it creates two accounts. One, the critical maintenance fund that deals with this big backlog of maintenance that we have.
Right.
That's 70 million as amended. And then it creates a capital improvement and land acquisition fund. That would be 80 million. So those are kind of our smaller projects like a kayak launch or a trail connector and acquisition of new state parkland.
All right, so 70 million for park maintenance.
Yes.
80 million for acquisition, you said?
I kind of lovingly call it acquisition, access, and activation.
Okay.
This committee knows we have part of our challenge and what led us to this bill is we've been acquiring,
Right.
and not investing in actually making those parks accessible or really any kind of activation of those parks. So that's what this fund is trying to correct.
So does the revision, because here it said the 30 million for land acquisition included areas in central and southern regions of the state to do these things, relieve overcrowding, sites with historical significance to
Yes.
minority communities. You need to do better on that language.
Okay.
Beachfront and waterfront property for public access.
Yes, so that's the result of the commission's hearings over the fall. We kind of heard what parks were missing and certainly what people were looking for in parks. So those kind of 4 buckets of priority. We have a lot of parks, but they're in the corners of the state in We could use more in central Maryland and southern Maryland. We heard waterfront kind of, and picnicking and swimming is a in-demand activity. What started with the Harriet Tubman Underground State Park, we want to continue formally in addressing the need to preserve and tell the story of important Black Marylanders through our state park system. So that's why that's a priority. And then the last piece, forgive me, Senator, there was 4. It was Central Maryland, waterfront, Black history, and the 4th piece was better connected to transit opportunities.
Transit, yeah.
Yep, understanding that
So that's
not
20
everybody.
million. So that's 20 million that stays. So
Yeah.
20 million for transportation improvements.
Yes,
Okay, targeting investment, so transportation improvements within the park? So, I'm sorry, page 9 of the bill, so I'm on page 9 of the
okay.
bill. And it lists through the different uses.
yep,
And it's 70 million, and then it breaks down the 70 million, I
Yes.
guess, into 5 million for infrastructure, 5 million for historic preservation. Are any of these amended? 20 million for transportation improvements?
Matt, there will be one amendment. I think it's adding 10 million to be kind of, I don't call it a wild card, but unidentified, but amongst these priorities.
And then the 30 million for the land acquisition that you're saying is not really land, but it is.
It is
'cause
land
you wanna-
acquisition.
You want to
Yep.
acquire some
Yep.
beachfront property and waterfront property.
And Central Maryland property.
In
yeah.
central Maryland and southern Maryland. So there's nothing in western Maryland, I guess, that we want to acquire, or north?
We certainly do, but that's also where a majority of our state park land exists, and recognizing we need parks closer to the population centers as well.
Okay,
Yes, yeah.
yeah. And then the other thing, because I was also, and I'm glad that you're here, Senator, because I was trying to understand the Conservation Finance Act. Is there any? No, I mean, is there any relationship between the two of these? Because it does, in fact, talk about
Yeah.
creating a fund that will essentially be able to sell credits in a private market and a private investment based on acquisition of state money. I'm trying to understand that. So is
as-
there a relationship between the two?
As the primary sponsor of both, that was not at
Yeah.
all top of mind in
But
terms of
does it
relationship.
no, I'm just saying.
But
does
there
it have
is a relationship.
Yes.
Just above this, thank you for bringing it up,
Yeah.
the 5 million for infrastructure projects.
Right.
That really was, kind of, our thought process there was the green and blue infrastructure we are formally defining in the Conservation Finance Act.
Right.
We kind of also plugged in here, recognizing that, we have a lot more work to do on flood mitigation, tree planting, forest buffers that we can do on state parkland. So that's the only nexus as the primary sponsor of both bills that I sought.
It would be a way to fund those projects?
No, the Conservation Finance Act, no, it was not our vision that would fund parks projects.
But it's okay, but so there's a relationship, so we'll,
Kind of, but on the blue and green infrastructure piece, but
Only
I
on
wouldn't say
that.
relationship or more as one, that piece inspired the other.
okay, yeah, Mr. Chair, I do have I think there's a lot to unpack on this, and I'm sorry that we were looking at other bills, but I do think there's a lot here to better draft and better articulate and understand.
Okay.
So I'd like to hold it if I could.
Senator Hester. I did.
My question is about, in any of these parks, either existing or new parks, is there one of these funds that deals with new construction, or is it all maintenance of existing construction?
Well, that would be envisioned in the CIA fund, the Capital Improvement and Land Acquisition Fund. That was, because we've had this conversation about the problem that we keep acquiring land but not
Yeah.
providing any funds to actually turn it on, let's say. And so that's really the vision with the $80 million Capital Improvement and Land Acquisition Fund.
What page is that on?
Oh, gosh. Pardon me while I...
Page 7 it starts.
Thank you. Page 7.
Okay, I think what we're going to do, there's been a request for a hold. We're going to be voting it on Thursday.
Okay.
And we're already holding the other bill. And I think John Griffin will be here on Thursday, who's more familiar with it. And I think, I don't know, Matt, are you also handling, you are handling this bill? Maybe Thursday, if you're not voting in your committee, maybe you can join us for a voting session before then. But let's get any questions out now. Senator Gallion?
Thank you. Just one last question. As we add to our, state park ground, most of these areas have, privately owned farm ground around them. So I was rereading Farm Bureau's testimony, and you mentioned their First Amendment request, which was kind of answered my one question. The second one was to dedicate funds to maintain the wildlife more properly in the state parks. They requested $500,000 a year for 4 years. So that would basically, you get more deer pressure coming from the state parks onto crop ground,
Yep.
more crop damage, stuff like that. So is that in the?
No, they did not provide that to me in a requested amendment outside of the testimony. If that's something, I have a lot of deer as well in my district. It's a huge problem. If that's something this committee would like to add in terms of wildlife management, I'm not sure 500,000 in a year is right, but I hear you that that's a problem, then we could address it in the bill.
Okay, thanks.
Thank you, Mr. Chair. Sponsor, Mr. Bennett, Ms. Foxworth, I have four, not Ms. Foxworth, I have 4 quick things to ask you about. First off, on page 4, lines 24, 25, we had a bill today from Senator Gallion on can you just define what an electronic asset management system is? And I wonder whether there's any possible collaboration there.
signboard?
I don't know, we're about to find
No,
out if
it's
that's what
it's
this is.
it's a better way for a DNR to be cataloging the critical maintenance needs. Right now, a lot of it's being reported from the rangers, and I'm happy to share with folks a very long spreadsheet of needs. But we're asking DNR to create a better online platform for this, and they actually already are. We just heard about it in our capital budget
So it's
hearing
only,
tonight.
okay, it's only an internal device.
Yes, it's an internal device, yep.
Okay, thank you. Next question, on page 8 of 32, lines 21 through 24. Can you just explain to those of us who aren't on BNT how we cross off 70 million, do 36.8, and then go back to the first 70 million?
That is an excellent question, and I have a chart for it, if anybody would like to see my fun chart. There was a slight drafting error that identified general funds instead of utilizing a piece of program open space stateside. And so this amendment that you have before you corrects that. So we're taking away the general funds in the bill and replacing it with 60 million in program open space stateside. So it's a little bit of fun math, and I'm happy to provide you my chart.
Okay,
It's better visual, I promise.
okay. Page 12, lines 18 and through 19 as amended. Do you have any objection to removing the word citizen in 2 places?
As long as the spirit of it remains.
I don't know how that would change the spirit, but I think we want members,
Okay, that's
whether or
fine.
not they're citizens. That will be my request for an amendment. And then the last thing, could you just talk us through, please, pages 27, 28, and 29 about presumption?
Yes.
Thank you.
Excellent question. So the Rangers, and again, this is the work of many months of the commission over the fall, the Rangers came to us requesting first responder status.
Right.
It's important to note they are paid significantly less than our county park employees and our national park employees. So we thought that was a very reasonable request. It will certainly help with certain tax credits, et cetera. Another drafting error, it's a big bill. Mistakenly drafting pulled in every presumption for police and fire, and we did not intend for that. We've since worked out with the state's insurers and the finance committee that we would just strike everything but keep Lyme disease, which I think is a very reasonable accommodation considering our rangers are constantly outside and in the forest.
I've been in the weeds on this stuff, on 911 stuff,
Yes.
presumption, so, okay. All right, thank you. Thank you, Mr.
Sorry, I'm still back on the new construction.
Okay.
And I see the 80 million, which is now 70 million. It's page 7.
Okay.
Maybe council can answer. No? So I'm wondering, like, if you buy new land and you want to put up a park building, where that money comes from. And what I see is that 70 million getting, then broken down, 5 million for climate change, 5 million for historic preservation, 20 for transport, 10 for water access, and 30 for land acquisition. So where is the money for new buildings?
For new buildings?
Yes.
It's not identified, but as I mentioned, the amendments provide for another 10 million of kind of ambiguous money that could be plugged in for any of these priorities.
I'm not adding it up.
Are you seeking, you want specifically for when we acquire a new park that we have a fund that provides kind of X, Y, and Z, whatever it requires?
Well, it started off as a question, and then
Okay.
I just can't find it in the bill. But I do think if we're acquiring land, there's got to be, like, improvements to the land. And so we're doing a lot of, I think maintenance of our existing buildings is most important. But I thought you said that there was also money for potentially for new construction, should we need a new building on a new park? And I can't quite find it in the bill.
I'm not sure it's articulated in the bill so much as in the spirit of the bill. And at the same time, these are two funds, but we also should keep in mind the DNR's park budget every year will also provide money. This is not the be all and end all of park budgeting. It's just two specified funds for these two specified purposes. But if you would like to consider to pull another 5 million or something for that exact purpose, that's the,
And just to clarify too, because the money for, so it specifies the money for historic preservation, transportation, increasing water access, but all of those could be
Right.
capital development projects. So, historic preservation, if you go down, that includes historic rehabilitation and property development. So that could be money towards, restoring or developing a historic property. Same thing for water access. It specifically mentions boat launches, areas for picnicking. So I think even under that, you might be able to build facilities by the water and things like that. It's sort of, it's designating the big picture language for what this fund can be used for is earlier. It's, so page,
line 16.
yeah, so page 8, lines 5, completing state park projects related to capital improvements. It's there's a broad authorization, but then there's these more specific sort of categories in which those capital improvements are sort of expected to fall, would be my interpretation, unless
Okay,
you tells me other.
let's take a break on this.
Okay.
If there are amendments, bring them in on Thursday, and if possible, if you have them ready, share with our council or their council or both. If it has to go back up, it has to go back up. That's all there is to it. That's all.
And I'm happy to sit down with any member to talk through questions or solutions.
Right, and I've also offered you on the other bill, so you have double duty.
There also is, sorry, there is one more amendment that I just passed around, being offered by the bill sponsor, that deals with the 100 new full-time positions within the Department of Natural Resources, which my understanding was sort of, was kind of intended by the original bill, but with developing negotiations, they felt like they needed to spell it out. So that amendment is also in your possession.
Yeah, one of the findings, as I recall, is the short staff.
Yes.
That's happened in all of these parks, to be able to even stay open and to service the many people
Yes.
who have been going there. So that's response to that.
Yes.
Senator, if it's a question for these folks, if not, sure.
Just since we just got this amendment, I just didn't know was there consultation with the department on, obviously, the number of positions, the 90, the priority with going to the Park Service, but this breakdown on the other positions, was there any interaction with department leadership on those areas that were selected?
Yeah, we've met with the secretary a number of times on this bill and taken a number of amendments from the department. The amendment clarifies that these are new pins, so they can't be kind of swapped around amongst DNR, but that they are new pins. And then we specified where the commission heard over the fall there are real needs, part of which is in this land acquisition side of things, which is why we have a significant amount of money just sitting in program space stateside right now, because we just do not have enough staff to acquire new land.
So there was consultation, obviously, with the priority on the 90 positions in the Park Service, but when you get into the positions with engineering and construction, land acquisition, and then you get into, I guess, additional positions for the Assistant Attorney Generals?
Yes, to help with land acquisition, and on the engineering side, that's to help I believe somebody mentioned, this is a lot of money for them to get out the door, and actually, particularly on the critical maintenance side, they will need more bodies to help execute those capital projects. So we did consult with the secretary.
Do we know how many Assistant Attorney Generals are in the park? We're adding, 2 positions for the Assistant Attorney General?
I don't have that off the top of my head, but happy to get it to you.
Thank you.
Thank you.
Thank you all for joining us. I'm sure it's how you'd like to spend Tuesday night. please go get dinner. It's on B and T, or it's on
Thank you. See ya.
dinner's on Marbidco. Okay, let's go to the last bill. Who's got that?
All right, Senate Bill 604, Maryland Electricians Act revisions. This also was a hold from last week. I can go through what the bill does again, or I can kind of just summarize the amendments. I'll just summarize the amendments. So in general, the bill authorizes apprenticeship credit for master electricians and journeypersons electricians. It requires the Department of Labor to issue a memo of understanding by looking at other states' laws and regulations so that other states will recognize Maryland electrical licensing. In general, that's a summary. So there are two sponsor amendments that are included in the packet, one amendment by Senator Carrozza. The first, I'll start with the simplest of the two sponsor amendments, begins on page 52. And so they're technical, we discussed this, but I don't recall if we moved it or not.
This is McCray amendment.
There are two. This first one is a technical one, the second is more substantive. So this first technical one, beginning on page 52, changes the name of the accreditation approval entity, since it has been changed, to conform with existing practice. So the entity that approves it is the Division of Workforce Development and Adult Learning. That's consistent with current practice. The more substantive sponsor amendment begins on page 45, and this amendment makes several modifications to insurance provisions. If you look at page 47, it requires the applicant to meet insurance requirements that are altered under the bill, and exempts, so in general, requires master electricians to have insurance. The bill, as drafted, would have provided an exemption for those master electricians and those whose local registrations were assigned to practice locally by the master electricians, if the employers had insurance. This is kind of broadening the scope and saying that that exemption applies for master electricians and the local assignees, so long as the individual that they are contracting with has insurance. So instead of it specifically being the employer, it's the individual that they are contracting with. Requires a local jurisdiction.
Hold a minute.
Okay.
The person they're contracting with is their employer, aren't they?
Or it could be an actual legal contract. Most of the time, it will be the employer.
I understand, but you're,
Well, this is
but I thought the electrician could be part of a subcontract, but the subcontractor would be their employer, wouldn't they?
So the onus
if
is.
they are the subcontractor, I understand that. Anyway, I don't want to screw up the works. Please, continue.
Okay, so it requires or authorizes a local jurisdiction to delay issuing a local electrical permit until an additional permit is issued if the local jurisdiction requires an additional permit, local permit, for another purpose. It states that a journeyperson electrician is not required to obtain separate insurance if the journeyperson electrician is working within their scope of practice. Requires the Board of Electricians, and this is on page 50 of the reprint. It requires, this is actually beginning on, what's that big kind of onslaught of text between line 7 and line 8. So beginning at 2, if an applicant for a master electrician's license does not submit proof of insurance, State Board shall print on the applicant's license that the applicant does not meet the insurance requirements. So the Board of Labor, or the Board of Electricians within the Department of Labor is required to indicate on the master electrician's license whether they meet the requirements for insurance to practice. However, this should mention, and I kind of got this signed off by the department and the sponsor, that subsection 2 should apply only in the event of contractual services where that licensing or that insurance exemption applies, so that it's not contradictory, because there is a general requirement for master electricians to have insurance. And this is saying if they have it, but it kind of could create confusion because it shouldn't be an if, it should be a must or when they have it, unless it was that contractual exception that I just mentioned. Just reading to make sure that takes care of everything.
Has the board seen these amendments
Yes.
and given their blessings to all of them?
So I know that they were in the works on these, and if I recall, there was a meeting on yesterday with the board and the sponsor. They haven't said whether or not they signed off formally, but it's my understanding that they were pretty integral in the process of it.
Senator?
Do we have any other board having to do with home improvement, plumbing, any other of our licensed trades that have an insurance requirement like this?
I'll have to check. If you give me 2 minutes, I'll check.
You can tell me tomorrow. I'm pretty sure I know the answer. Thank you,
Okay.
Mr. Chair.
Well, so just picking up on Senator Riley's question, what is the intent behind adding all these requirements around insurance? Like, these are the sponsor amendments?
So the amendment, so yes. So current law is that $100,000, $300,000 in general liability and $100,000 in property insurance be required. There are additional requirements that are added, not so much on the amount of insurance provided, but kind of how the board handles insurance through the lens of the applicant possessing it. So the insurance requirements are already codified in law. They have to have insurance. I just wanted to clarify that piece.
Currently, if I'm reading on page 4, above the new language, the old language said an applicant for a state license shall submit proof of the insurance required under the section to the state board of the license application.
Right.
So conceptually, it's not new. They have to have insurance.
Right.
So
Right.
the only change is if applicable, and then you've got these conditions down below.
And instead, it was kind of the formula was a little different because under current law, it says an master electrician shall, have insurance, but this changes it to the negative where it says electrician can't practice without insurance. So, technical, but, yeah.
Thank you, and I know there's been a lot of work on this bill, and I appreciate Senator McCray working with me specifically on the Worcester issues. So yesterday, there was a Zoom meeting with the Department of Labor, with the House sponsor who was representing in coordination with Senator McCray, as well as the Worcester reps. They did talk about on the issue of the insurance requirement. They did talk about that, but that issue was separate from the Worcester issue. But my understanding from that conversation on the insurance, especially with what Andrew, the Department of Labor sent to you, it makes clear that provide a current certificate of insurance in compliance with the requirements of, and they note the law that's already requiring the insurance. So I'm not the expert on the insurance part, but Department of Labor was on the call, and they were the ones who provided the amendment that also applies
Permit.
the section that we needed for Worcester County.
The permits.
So, so on the 5 that they sent over.
Yep, that's right.
Ladies and gentlemen, I think we're all burnt out, and these are somewhat substantive changes. I think we're going to hold it till Thursday. I think we would be doing a disservice if we voted for this tonight. Please check, and I'll try to check if I have time with Senator McCray about what his amendments do. They're somewhat significant, and how it fits in with Senator Carrozza's recommendation as well. So we're going to bring this to a close. We'll put, yes.
Want to consider on a bill that has been assigned to EHE through rules, but should go to finance. So we would want to vote to refer that to finance, the appropriate committee. Senate Bill 909, it pertains to nursing home administrators. So when we first, did the assigning, it was incorrectly assigned to EHE, so we voted it to be transferred to finance, but when it came out of, so it ended up going to rules somehow. Now it's out of rules, and it was assigned to EHE, but it's not under our jurisdiction. It's a finance-related bill, so it needs to be voted on to move it there.
Yeah, right. Yeah. Okay, look, we'll get a list out to you tomorrow. It's like 4 from today, and there are only another, well, there may be 4 to 6 others. It's not a super long list. Discussions are still going on 528. I'll give you notice when we're taking that back up. Ms. Stanton asked me to ask you if later in session you wish to have a committee party off-site at a restaurant, like in some number of weeks. I assume in 3 or 3.5 weeks. Well, I mean, that's a question. Obviously, when you're eating, you can't wear a mask. And hopefully, if it's just in a room with just ourselves who've been all tested, hopefully it's not a problem. And my guess is the wait staff will be wearing masks. So,
Could we do it on a Tuesday and have it be a testing day?
why don't we come up with tomorrow with a couple of other suggestions, or Thursday, and we'll take up some possible dates. Any other questions for the good of the order before we adjourn? Vice Chair?
Thank you. 2 quick things, just a reminder, we are one of the pilot participants in the compost bin, so try to keep adding stuff so it shows that it's, appreciated, used, and all that. And as the Environment Committee, can we try not to ask staff to make 1 million more copies of these really thick bills? So if you can bring your copies with your notes and stuff back on Thursday, I think that would be great, if you can. And save Lemoria and others some time at the photocopier.